Hey there, welcome to this explainer all about the surprising health benefits of oily fish. You've probably heard it a million times from doctors, nutritionists, and health guidelines, right? Eat more fish. But why? What is actually happening inside our cells when we do? Well, that is exactly what we're going to unpack today using some of the latest data from the Mayo Clinic, the American Heart Association, the Arthritis Foundation, and more. Let's dive right in.
So, I want you to think about this for a second. What essential nutrient is your body absolutely begging for to function optimally, but physically cannot manufacture on its own? The answer is a very specific type of fat. It acts almost like a highly skilled marine mechanic for your cellular engines, keeping everything from your heart to your brain running smoothly.
That nutrient is omega-3 fatty acids. These are polyunsaturated fats, which is just the scientific way of saying they're healthy fats. But here is the absolutely crucial point. They are essential. In biology, essential literally means your body cannot make them from scratch. You absolutely have to eat them to survive. The big three you need to know are EPA and DHA, which you primarily find in marine life, and ALA, which is found in plants like flax seeds and walnuts. Okay, here's our roadmap for today's anatomical tour. First, we'll meet the healthy fats. Then, we're going to look at guarding your heart, boosting your brain and mood, and calming your aching joints. After that, we've got to talk about the catch, which is mercury risks. And finally, we'll wrap up by building your omega plate.
All right, section 1, meet the healthy fats. Not all omega-3s are created equal.
To build our foundational understanding here, there's a huge misconception we need to clear up right away. Not all omega-3s are exactly the same. They just aren't. Now, plant sources like chia seeds and walnuts are incredibly healthy for you, but your body's process for converting that plant-based ALA into the usable EPA and DHA, it's incredibly inefficient. Studies actually show that less than 10% of the ALA you eat is converted to EPA, and less than 1% converts to DHA. Because that conversion rate is just so low, getting direct marine sources of EPA and DHA becomes incredibly valuable to your body.
Let's move on to section 2. Guarding your heart, cardiovascular defense. Keeping that biological rule in mind, let's take a tour down to the cardiovascular system to see what these fats actually do once they're inside you. The American Heart Association and the Mayo Clinic have heavily researched this, and the data on cardiovascular protection is robust. EPA and DHA act like a literal maintenance crew for your heart's plumbing. They lower triglycerides, which are the fats in your blood that can lead to plaque buildup. They actively reduce inflammation in your blood vessels, slightly lower your blood pressure, and even help prevent blood clots. They also help maintain a healthy heart rhythm, reducing the risk of sudden cardiac death from arrhythmias. It's really a comprehensive vascular defense.
Section 3. Boosting brain and mood, fueling your cognitive engine. Now, these fats don't just stay in your chest, though. They head upstairs to the brain. And I have a fascinating and maybe a little surprising fact for you. By dry weight, the human brain is 60% fat. It is essentially a fatty engine. And of those polyunsaturated fats making up the brain, about 40% of it is DHA. It's particularly concentrated in neuronal membranes in areas like the hippocampus, which is exactly where your memories are formed. Your brain structurally relies on these fats to help brain cells communicate. If you don't eat enough of them, animal studies have shown a literal decrease of DHA in the brain, leading to measurable deficits in learning and memory.
Because of all this, there's a lot of hype around fish oil as some kind of miracle brain cure. But we need to look impartially at what the clinical data actually says. Early interventions for mild cognitive impairment, or age-related cognitive decline, do show real promise. However, taking fish oil does not show compelling evidence of improving or curing full-blown Alzheimer's disease. Where we do see some incredibly interesting, positive data is in mental health. Taking fish oil supplements, especially those higher in EPA, has been shown to improve depressive symptoms, with the greatest effects seen in folks who are also taking prescribed antidepressant medications.
Section 4. Calming your aching joints, the anti-inflammatory effect.
Moving from the brain down to the joints, this next part is incredibly important for anyone suffering from autoimmune conditions because omega-3s have a profound anti-inflammatory effect. In conditions like rheumatoid arthritis and lupus, the body's immune system mistakenly attacks the joints, which causes severe inflammation. The Arthritis Foundation highlights that high doses of EPA and DHA actively squelch those inflammatory immune cells. It significantly reduces morning stiffness for RA patients, lowers inflammatory biomarkers in the blood like C-reactive protein, and decreases specific markers like IL-12 and IL-13 in lupus patients.
In fact, some studies showed that patients taking these high doses were actually able to reduce their reliance on NSAID pain medications. It acts as this wonderful natural biochemical lubricant and calming agent for autoimmune flare-ups.
Section 5. The catch: mercury risks and contaminants.
At this point, you might be thinking this all sounds amazing, and you should probably just eat fish for breakfast, lunch, and dinner. But we have to acknowledge the elephant in the room. There is a catch, and it's a serious one: environmental pollutants. Because of pollution in our oceans, mercury builds up in the food chain. Big, long-living, predatory fish eat smaller fish, and they accumulate all that mercury in their tissue. You want to avoid big predators like shark, swordfish, marlin, and king mackerel. Mercury is a potent neurotoxin, and it is especially dangerous for pregnant women and the neurodevelopment of young children. Instead, you want to focus on smaller, lower mercury choices that are still absolutely packed with omega-3s. Think salmon, sardines, herring, and canned light tuna.
Which brings us to Section 6, Building Your Omega Plate, Dietary Guidelines, and Practical Tips. The crucial point here is knowing how to safely get these benefits into our actual, practical weekly routines. How do we build an omega plate that maximizes the health benefits while minimizing those environmental risks we just talked about? Well, I want you to remember this number: 2. Major health authorities, including the FDA, the American Heart Association, and the UK's NHS, they all generally recommend the exact same thing for healthy adults. Aim for at least 2 servings of fish a week. A serving is about 4 ounces cooked, so roughly the size of a deck of cards. Hitting this number gives you the sweet spot of cardiovascular and cognitive benefits without overexposing yourself to contaminants.
Now, what about the great food versus pills debate? Health experts generally agree that getting your nutrients from whole, oily fish is superior. Why? Because a piece of salmon doesn't just have omega-3s. It's packed with synergistic nutrients like vitamin D, B12, and selenium that all work together. Fish oil pills just provide a concentrated dose of the fat, lacking that whole food nutrient density. Now, pills definitely have a clinical place, especially for high-risk patients or those treating severe joint inflammation. But you have to be careful. The latest research indicates that very high doses of fish oil supplements can actually carry a minor risk of causing atrial fibrillation, which is an irregular heartbeat. So always talk to your doctor before going the high-dose supplement route.
I certainly don't want to leave out our plant-based or vegan viewers. If you don't eat fish, how do you get around that terrible ALA conversion rate we talked about earlier? The answer is algae oil. This is the true gold standard vegetarian hack. Think about it. Where do you think the fish get their omega-3s from in the first place? They get it from eating microalgae. Algae oil supplements literally cut out the middle fish, providing you with direct, bioavailable marine-level DHA and EPA that is completely plant-based.
So, let's summarize our actionable takeaways here. Step 1, aim for those 2 4-ounce servings of fish weekly. Step 2, make absolutely sure at least one of those is a low-mercury, oily fish like salmon, sardines, or mackerel. And Step 3, if you choose to go the supplement route, consult the doctor first. This is especially vital if you happen to be on blood thinners because omega-3s naturally help prevent blood clots, and you definitely don't want to overdo that effect.
We've covered the cellular mechanics, the cardiovascular defense, the brain fuel, and even how to safely navigate the seafood aisle. So, I leave you with this final thought. Knowing your brain and your heart literally crave these essential fats to survive and thrive, how will you choose to fuel your body's engine on your next grocery run? Thank you so much for joining me for this explainer, and here is to your health.